You may be very concerned right now because you've noticed persistent itching, burning, redness, maybe white areas on the labia majora, groin, and you may have had repeated episodes of what seemed like a UTI with all the proper symptoms that seemed to be resistant to antibiotics or responding in a very peculiar way. And finally, your dermatologist, OB-GYN, urologist, or your primary care physician even, they've told you they have lichen sclerosus. Or you may have figured it out yourself through research online. Dr. Yuval, Bibi, dermatologist, if you have lichen sclerosus or suspect you have lichen sclerosus, don't touch that dial. In this video, I'll give you everything you need to know about lichen sclerosus so you can deal with it in the best way possible. And I'll provide a super hack to turn that stubborn lichen sclerosus around or make it much better than it has been so far. Before we get started, I want to stress that any persistent problem of the vulva or the vagina must be diagnosed and managed with the help of a doctor, specifically a dermatologist. There are a lot of moving parts, and while I do want to educate you and help you get your bearings and make it much more easy for you to work with your doctor, the next step after this video should be the doctor's office. So what is lichen sclerosus? In a nutshell, lichen sclerosus is a chronic inflammatory condition that mostly affects the privates in women. It can affect the perianal area as well, and it may extend to other parts of the body, but most commonly it involves the groin area and the perianal area in a figure of 8 configuration. The condition appears as initially red areas that may burn, itch, or hurt, or be completely asymptomatic that eventually turn into white glistening areas with thickening and hardening of the affected skin and mucosa. And in more severe cases, affected parts, specifically around the genitals, may actually become scarred and atrophy to the point where there are anatomical changes. Now, the condition may affect men as well, as I've talked about it in my balanitis xerotica obliterans video, but women are more commonly affected. We don't know what causes lichen sclerosus, and it is considered an idiopathic condition. While there may be some discussion about genetics and other external factors, ultimately, all lichen sclerosus cases are managed essentially the same. How do you know if you have lichen sclerosus? Well, the most effective way of discovering whether or not you have lichen sclerosus is evaluation by a physician, specifically a dermatologist. Some OB-GYNs and urologists, even primary care physicians, may make the diagnosis, and in most cases, the diagnosis is made by a dermatologist. How do you know you have lichen sclerosus? Well, first, do not self-diagnose, as in settle for what you think you may have without the expert eye of a dermatologist or another expert in the field. Lichen sclerosus can definitely be confused with other conditions, and that distinction must be made to treat the condition effectively and avoid other complications. So how's lichen sclerosus managed? Well, first of all, great skin care. Lichen sclerosus presents a challenge because it is a chronic inflammatory condition. In chronic inflammatory conditions of the skin ceases to function normally and the skin barrier is undermined. So your first goal would be to do no harm, as in stop the abrasive practices to the best of your ability. Stop soaping of the area, cleansing, using anything that comes in a bottle or in a bar to cleanse the area, which gets rid of the skin barrier. Not to mention stopping the use of any physical abrasives on the area like a scrub or a loofah, a washcloth. Even your hand in a circular motion or in a rubbing motion vertically will be harmful to the area, so please stop doing these things as they are harmful to the skin. And remember, lichen sclerosus is not a hygiene problem. It is not a cleanliness problem that you can cleanse yourself out of. In fact, you will be making matters worse. Then moisturization of the area is essential because the skin barrier, once again, is dysfunctional. It would be greatly beneficial for you to apply an occlusive moisturizer such as Butter Oasis Moisturizing Balm, Butter Blossom Moisturizing Balm, or petroleum jelly, and we'll touch on how to use these occlusive moisturizers more effectively for more stubborn cases. Avoid using lotions, creams, and any other skincare products on the area, as they are going to be of very little value up front, and they may actually cause more undermining of the skin barrier. Most cases of lichen sclerosus respond really well to topical medications, specifically topical steroids. Super potent topical steroids work the best, applied twice a day with the help and guidance of your dermatologist. The treatment should aim to decreasing the features of lichen sclerosus, specifically the scarring, thickening of the skin or mucosa, and the white discoloration that appears that is the atrophy associated with the condition of the upper layers of the skin or the epidermis. That sort of treatment is best managed with the help of your dermatologist, so please consult your doctor right away on what is the right way to apply those medications. There are other topical medications which may bring you some success in managing lichen sclerosus, like calcineurin inhibitors, but ultimately the best treatment for lichen sclerosus lies in the category of topical steroids. Additional treatments like laser resurfacing or platelet-rich plasma may be of benefit in more stubborn cases, but are very costly upfront. And I suggest looking into those with some reservation. However, in some cases, they may actually bring you significant long-lasting relief under the right set of circumstances and in the right set of hands. There is the question of whether topical estrogen or estradiol may be of benefit in lichen sclerosus, and the discussion goes back and forth, but ultimately the evidence to support use of topical estradiol in lichen sclerosus is limited. And I've seen some cases where there is actual vaginal atrophy that may be related to menopause. In those cases, adding the topical estradiol to the regimen may be of benefit, but not necessarily to the lichen sclerosus itself, but rather to manage other symptoms and conditions that are unrelated. It is absolutely crucial to discover, diagnose, and treat lichen sclerosus as early as possible. Early detection is of paramount importance because if lichen sclerosus advances and goes through its various stages, it can lead to significant problems, specifically sexual dysfunction, anatomical changes that may actually disrupt other functions like urination and may cause other issues as well, and may actually lead up to changes that could potentially be the hotbed for cancer of the area. So early detection, management, and prompt follow-up are essential to lichen sclerosus. It is important to note that in many lichen sclerosus patients, UTI symptoms are part of the problem. They're actually not UTI. We're talking about frequency and urgency of urination, maybe even burning when urinating. Those symptoms may actually be part of the lichen sclerosus that affects the urethral opening or the external meatus, as well as the internal urethra. That issue needs to be diagnosed with the help of a urologist, and I suggest that if you are experiencing frequent UTI symptoms and have no UTI, as in the urinalysis and the culture are negative, check with your dermatologist or your urologist to diagnose and manage the problem appropriately. Now, when you have lichen sclerosus, remember, bad skincare can really affect the problem adversely, so do not cleanse and scrub the area. That is a no-no. It's actually going to undermine the skin barrier. It will drive the inflammation further, and while bad skincare does not cause lichen sclerosus, bad skincare may actually affect it adversely, so stay away from scrubbing and cleansing, as well as water-based lotions and creams that may make your problem worse. Now, in my experience, there's a great skin super hack that may actually help lichen sclerosus turn around in the hands of the patient, and that super hack is called slugging. Slugging is the generous application of an occlusive moisturizer like Butter Oasis, Butter Blossom, or petroleum jelly to the affected area overnight, allowing the area to recover as much skin barrier and skin function as possible. Slugging was originally coined for the face. However, in my experience, slugging works extremely well in lichen sclerosus patients. How do you slug the privates? Well, you slather general amounts of the Butter Oasis, Butter Blossom, or the petroleum jelly on the area. You may wrap a plastic wrap around the area, patching it, and then lay a towel on your sheets so you don't stain them overnight. Wake up the next morning and pad the residue away. This should be done in conjunction with topical treatment, and in my experience can turn a lot of those stubborn cases of lichen sclerosus quickly around, making the area look much more normal than it would have been without the help of the slugging. Slugging likely works in allowing the skin to recover much more quickly than it would have without the protection that slugging affords it. And as I mentioned earlier, in chronic conditions, and namely in lichen sclerosus, the lack of skin barrier integrity is one of the major issues affecting the skin in those conditions. As I mentioned earlier, lichen sclerosus must be diagnosed and managed as early as possible. If it is caught early, a lot of the damage down the road can be avoided and even reversed. If it is caught late, it is very difficult to reverse lichen sclerosus. So please see your dermatologist with the earliest symptoms and signs of something resembling lichen sclerosus so you can get your condition treated and avoid the very unpleasant circumstances that affect patients who've come to the table late to manage their lichen sclerosus. Chronic lichen sclerosus does increase the risk for cancer of the area slightly. So if you've noticed any sore or pimple that just appeared out of nowhere over any of the areas that are affected and will not go away for more than 2 weeks, see your dermatologist as soon as possible to evaluate the lesion and make sure you don't have cancer of the area. Cancer of the area can be managed, and especially if caught early, can be cured by surgery or other means. So please see your dermatologist as soon as possible with any suspicious lesions. Let me know in the comments section how you found this video helpful. Also, don't forget to share, like, and subscribe for more no BS skincare advice. See you next time. God bless.